Cortez Masto. We'll begin a second round here for those that are interested. Mr. Spown, you had mentioned the 105L leases. We all know that this is a critical tool for the tribes as they're delivering government services. We heard earlier this month from Tlingit Haida that they had, talking again about lack of tribal consultation to some of the changes made, but changes made to the guidebook, the BIA 105L Technical Assistance Guidebook. You referenced the use of 3 comparable sites in appraisals. And so, Mr. Bellmard, I'm going to ask the question to you because what we're trying to do here is meet the requirements of the law, meet the requirements of the trust responsibility. When you put in place guidance that is really not only not practical, but simply not workable in a place like Alaska, again, requiring the use of 3 comparable sites in appraisals, where you simply don't have comparable facilities. I'm assuming this comes about because somebody just wasn't thinking, they weren't thinking about the challenges that we face in so many parts of the country, but most particularly up in Alaska. You are implementing before tribal consultation has occurred, and now you have situations where you've put yourself in an untenable place. How are you going to, how do you unwind this? Because if these stay in place, you have effectively stalled implementation. You certainly do nothing to reduce the backlog that you're already dealing with. Talk to me about just one simple example like this.
Thank you, Senator, for that question. If I might just expand on this idea. Before I came here, I was a tribal attorney for 35 years. I lived, and my office was in a town of about 300 people. We took advantage of the 105L program, which is a very popular program. To get 3 comps in Caw City, Oklahoma, I would agree, like Alaska, that's impossible. When we had started hearing in our hallway that there had been some decision related to this guidebook, we immediately talked to our self-governance people, asked them to reach out to find out where that actual information in the guidebook had come from and to confirm that that is actually what we're doing. And if it is what we're doing, we have asked our folks not to do that until they can spend some time with us so we can determine why the decision in this guidebook was made for these 3 comps, because it is not practical for rural Indian country.
I'm glad to hear you say it. I would just ask that you move expeditiously on this, because if this is in place and you do have folks that are looking at things and saying, well, we don't have the 3 comps, so we can't do it. Again, what you are doing is just adding to further delay in execution of these 105L leases, and that's absolutely the opposite of what we're trying to do here. Mr. Joseph, I wanted to ask you a little bit about the Alaska Tribal Health Compact and the success that we see. We're not always recognized for the bright successes that we have. Oftentimes our statistics really drive negative stories. But we have a recognized model. South Central Foundation in Alaska has a recognized model which transformed healthcare delivery through the NUCA system of care. Tanana Chiefs Conference built a system that delivers comprehensive healthcare across some of the most remote communities in our state. And I think it really speaks to the level of innovation that we've seen under that compact. I'm often asked, how can the lessons that have been learned from models like NUCA, like what TCC has done, how can these be translated and applied more broadly across IHS, across the tribal health systems nationwide? You know, you've got good examples here at the table in both Oklahoma and Alaska, where exceptional things have happened. You mentioned the success in telehealth. We were pushing that out long before anybody else did it, and we did it because of necessity. The community health aides has been a model that we have put in place that others look to and say, how did you do that? The DHAT program that we began, the dental health therapists, what the dental health aides, and what that has been able to do for oral health. We've got so many good successes, but how do we take what we've proved out in hard to find success places, like we often see in Alaska, and build these into other systems? Or is this so unique to Alaska that it's only going to work at home?
Thank you, Chairman Murkowski.
You can tell I'm really proud of some of the systems we put in place.
And I'm proud sitting here listening to your knowledge about what successes that has happened in Alaska. You know, to answer your question, to me, there's the success in the compact itself is the willingness for all the tribes to come together with the regional providers under consensus and say, this is what's going to work for us. And that through the ISDIA, each of the tribes are able to self-govern what they need and be able to work through. Now, taking the successes and the innovations from one area to another area is really important. And it's so important that not only is it important through Indian country, it's important to rural America as well. And internationally, we're seeing more and more people wanting to come to Alaska to see, well, how are you guys doing this in providing affordable health care that is really efficient in delivering a positive health care system? And in CHAP, Community Health Aid Program, is the prime example of what can be being done nationally, as we're seeing that being rolled out now to more the I would say lower 48 tribes. And in seeing that successes, I think that's really important. What I would hope to see, though, is more communication between Alaska compactors and the tribes that have these programs, or whatever tribe that we're trying to share information with. See less burden and control and allow more freedom for development. And so you're taking a program that was developed at home and you want to share it with other tribes, well, let them share it with them. And then work with the tribes to try to knock down the barriers that could inhibit or delay that services. And so I just believe that there's a lot of opportunity for us to learn from one another and share, and those avenues are sometimes created. We can create more to expand those type of programs that would be beneficial. So I'd like to stop there on that answer. And if I could expand a little bit, you talked a little bit about 105L, and I wanted to give you a couple prime examples. So if you give me a couple more minutes, I'd like to jump into that. You know, recently Tanana has been applying for the 105L, and what we're seeing is a couple significant differences between health services, our IHS and BIA, and basically the timeliness that it takes to get it done. We're looking at 3 or 4 months to work through IHS on our 105L agreements, and it can take up to, right now we're being told, up to 13 months for BIA. So there's a significant time difference in what's happening. At the end of the day, it's all going to go back, but to the date of your application. But that's still a significant delay when we're looking at 105L being an important component to for the tribes. Secondly, when you're talking about what it takes to get comps and what it may, when you're looking at having to maybe multiply that by 3 or, times 3 to get 3 comps, the cost to just get 1 comp is really significant. And it took us months to get through that. And it depends on the number of facilities you have to have comped, and each one of those come at an additional cost. And so if you're having to look at, in Alaska, how to bring 3 to the table so that you can work through your 105 agreement, that's going to be at a very high cost, and in Alaska, kind of really hard to do, because we're trying to find people to go out to our communities to do these evaluations and assessments. So with that being said, I think that's important. The last thing I'd like to say on top of this, I've worked with a lot of good people on both the IHS and BIA side, and they all mean really good. But you also talked about what the shortage of staff have, and we've seen significant changes in Alaska in the way that is being delivered. So I just wanted to throw that out, and anything that creates more work for others, delay any application that we're trying to get through. And I'd like to talk more about that later. Thank you for this time.
No, and I appreciate you filling in some of those details. It's time, it's money, and it's those to process it. Senator